Hello, my name is Lee Stanfield, and I would like to share with you some facts about the two major health care bills now being discussed in the Senate and House, including facts that politicians are not telling us. Let's start with what they're calling a public option. Now, I'm very much in favor of a true public option, which will compete on a level playing field with the for-profit companies and bring down their prices. However, what our politicians are calling a public option is not what anyone outside of that industry would call a public option. And the playing field is anything but level. Proponents of these bills are relying on selling the ideas in them to the American people by telling us only certain facts and speaking in generalities about it. But as the saying goes, the devil is in the details, so let's look at some of those details. The public option, available only to those not already covered. Not available to 260 million American citizens, 88%, who will be forced to keep their current private plans. It will not cover 11 million of the 36 million citizens not covered now, nor the 9 million undocumented immigrants. In fact, the CBO estimates that the public option will cover only 4 to 6 million people. It will cost more than it saves because it's so small that it will have no bargaining leverage. Cherry picking is built into this bill. Because most healthy people are not allowed access to the public option, its members will need a lot more medical care and therefore cost more than the members of the for-profit plans. Now, despite this built-in disadvantage, it will not be allowed to receive any government subsidies. This carefully planned, forced financial failure will then be blamed on the public option itself, and for-profit proponents will claim it as proof that the government is not able to compete with the free market. So it will be forced to offer tiered plans at tiered prices. So just like now, only those with more money can get anything better than the most basic stripped-down coverage. In the Senate bill, any state can opt out of the public option, leaving its citizens with no option. Now let's look at the regulation of the for-profit insurance. I think it's actually lack of regulation. First, it says it prohibits denials for pre-existing conditions. However, there's no constraint on raising premiums for pre-existing conditions, and by law, you will have to buy it regardless of cost to avoid being fined. And as you age, the premiums will go up. Premiums for elderly will be allowed to become 2 to 3 times those of younger people. Then the government will subsidize lower-income people to help pay for premiums, which sounds great. However, only 70 to 80% of the premium cost is subsidized. And subsidies will not cover the other 20 to 30% of premiums, nor any part of the deductibles or copays. So you may not be able to afford to use the plan you are forced to buy. These subsidies are taxpayer money, and they will end up in the pockets of for-profit investors and CEOs. There is no cap on the cost of premiums, deductibles, and copays, and companies are already announcing they are raising them substantially for next year. The government will not cover abortion or allow purchase of a plan with abortion coverage if government subsidies are being used. All exchange plans will be high deductible, stripped down, and tiered. This is almost identical to the Massachusetts plan, which is now turning out to be a disaster. It prohibits rescinding of plans after an illness, which sounds great. However, there's nothing to stop them from continuing to deny covering doctor-recommended treatments, deny claims outright, indirectly deny claims by burying claimants in forms and not returning calls until the claimants go bankrupt or die. There will be caps on out-of-pocket expenses. However, those caps are set at $5,000 a year for individuals, $10,000 for families, and these amounts currently result in medical bankruptcies for millions of Americans. Employers must pay 72.5% of premiums for individuals and 65% for families. However, this will give any company who currently pays a higher percentage than that an incentive to shift costs onto employees and then dump them into the exchange because it'll be cheaper for the company. There will be an expansion of Medicaid. However, Historically, eligibility criteria and rates of reimbursement for Medicaid changes with fiscal circumstances of the states and the federal government. The enormous cost of this so-called health care reform will be paid for with billions saved by streamlining Medicare, getting rid of all the fraud, abuse, and waste. Well, that sounds good. However, getting rid of the excessive subsidies for the for-profit Advantage plans is about the only good thing in this bill. Then the claims of fraud and abuse in Medicare are currently being found to be overstated. So that's going to be a problem. There will not be huge savings being cited from eliminating those things that don't exist, so they may try to cut seniors' benefits to make up for that. This legislation could jeopardize the current laws in California and other states which require insurers to pay for treatments such as second surgical opinions, AIDS testing, and reconstructive surgery for breast cancer patients. This legislation could make it virtually impossible for states to enforce other consumer protection laws, such as the right to appeal if an insurer denies coverage for particular treatment. Bills in both the Senate and the House would open the door to insurers selling policies across state lines, which could allow health plans to take advantage of the lenient rules in some jurisdictions while avoiding tougher enforcement in places like California. What all this boils down to is that proponents of these bills cite the need for incremental changes, but these bills are not designed to do that. Instead, they guarantee the continued existence and unfettered profit-making power of the private insurance industry, which has been the core of the problem all along. Congressional leaders and President Obama have accepted enormous sums from the for-profit insurance and pharmaceutical industries, giving them massive influence over health care legislation. No longer a party of the people, the Democratic Party, like the Republican Party, has now become a party of mega-corporate interests. These bills, or any bill which emerges from the marriage of these bills, will hand over unprecedented billions in taxpayer money by setting a mandate forcing Americans to buy insurance from for-profit companies which are in reality not even really regulated. This will be a serious blow to democracy itself, because this money will flow back into even more campaign donations and kickbacks to legislators who are already heavily compensated to represent the vested corporate interest instead of the interest of the American people. So what can you do? Contact Congress at 202-224-3121. Contact the President, 202-456-1414. Tell them, I am a single issue voter, and my issue is universal single-payer Medicare for all. For even more impact, tell them to vote no on any bill based on the current two main bills, and to support H.R. 676 in the House and Senate Bill S-703. Tell them to support Medicare for All amendment to any bill that passes, and a true public option amendment based on Medicare for All, and the Kucinich Amendment.